Good afternoon. Thank you for being here for the last 15 minutes of the presentation. Thank you for having a timer here. My name is Dr. Jennifer Gentile. I'm a clinical psychologist by training. I've been on staff at Harvard Med School and Boston Children's Hospital, worked in their system for about 20 years now, and initially did clinical work and then became frustrated with the access challenge and also quality challenge in the field of mental health care, and went to work with Amwell, and it used to be American Well, where we developed the first telebehavioral health program in the US. And by the time I left that, when it didn't exist, the program had 80 million people had the program as a covered benefit. And exciting now that telehealth is something, an everyday thing, and it's accepted as a responsible and effective way to deliver mental health care. So I don't think I would ever think that I'd be sitting on a stage talking about the internet, about Web3. The title of this presentation is Web3 and the impact of health behavior change. But here I am. There's lots of opportunity for Web3 in bringing the decentralized technologies with the enablement of blockchain. And some of those impacts in thinking about on behavior health change, as well as physical health change, and hopefully we can think of physical and mental health as one, as the whole person, but thinking about things like data and privacy standards, greater opportunity for peer support within that, greater opportunity for personalization of healthcare right now. It's very much a one-size-fits-all in the field of mental health care, and we are sitting at recovery rates at 50%. So in the field of anxiety and depression, can you imagine that at a toss of a coin? That's your likelihood to get better from your mental health condition if you seek out evidence-based care. So in addition to potential opportunities, we also have the idea that there are challenges within this. So worry about how do we follow regulations. We're frankly in the new field, the new wild west of the internet, or the Web3 version of the internet coming up. We'll have new regulations. How do we follow those? How do we ensure security? How do we ensure that we're not increasing the digital divide with people? How do we ensure that everyone has digital literacy to be able to access their healthcare record that we're going to have on our iPhones and carry around our x-rays, right, with the radiology presentation? So I'm going to turn it over to our panelists. And I'm going to start with, if you could give, I know you each spoke, but if I could ask you to give a little bit of context of why health behavior change, how you think Web3 might impact health change and health behavior change. All right, would you like to go first?
Sure. I think there's one aspect, certainly, maybe, which has been mentioned, which is obvious. It's that multimodal data fusion, right, when we're talking about a particular assessment interpreted in the light of wearable data, for example, or something else, right? Whether it's a cognitive assessment for fatigue, for cognitive decline, is it fatigue? Do I have data from a wearable that suggests anything that would support either interpretation? But that's definitely something that I think it's clear. Another aspect that I think is going hopefully beyond these passive data for digital phenotyping, which is fantastic, but also going into more objective or performance-based measurements, especially when you talk about that in terms of mental health, cognition, so things that can be deployed remotely that will be going that extra step to not just have, again, a remote monitoring, but even in terms of digital therapeutics, right, for home training and treatment.
From my perspective, it's tokenization. The ability to have tokenization both for things like wearables and within the clinical trial context, all of a sudden opens up a wide opportunities to conduct research. The decentralized trials that can be enabled by tokenization also are going to be really important for health equity, enable to have a broader recruitment of patients from different demographic areas. And I'm particularly interested in this from the FDA's new diversity plan requirement, where any pharmaceutical and certain classes of medical devices require a diversity plan in order to be FDA approved. And the initial round of diversity plans that Oncology Center of Excellence at the FDA published their data, they panned like 80%. And that's a huge problem in a pharmaceutical company's life cycle. And then to actually be able to implement those plans, that's a lot of unanswered questions that our current infrastructure really isn't built or designed to execute on. It's all Web2, to be honest. And just trying to scale what we've been doing with Web2 is, I don't think is going to be the answer to address those issues at the scale that, one, we should as humans and people invested in equity, and now with the FDA making it a requirement.
I want to emphasize the context of data, especially for healthcare. For example, I want to give an example. If a physician prescribes a medication based on solely a number of blood pressure without understanding of context, immediately after exercise, it would be a really complicated problem. But from my understanding, currently many people are trying to aggregate data, just aggregate it as much as they can. But the real value from the healthcare data is understanding holistically the overall context. I believe the distributed computing, distributed solution help to understand better overall context of each data set, not just how aggregated, also understanding all the dynamics in longitudinally. So yeah, I'm interested in personally that part of that.
Thank you very much.
And maybe on that point, just that I think a really interesting aspect is the just-in-time interventions, right? I think we need to extend on what you're saying to get a sense of that longitudinal, personalized data, but then also to understand that an individual may be, whether it's GPS data, through other data, understanding that, oh, they are now going to a fast food joint. What are the issues there? Is whether for this particular individual, or they're going to the gym, or what do I need to think about to be able to deliver some information and some action at that moment, rather than just accumulating data and eventually interpreting it to have something that's just.
And I also noticed we have the mental health team on this side, and we have the physical health team on that side, and that was not intentional whatsoever, should say. I'd like to piggyback on that. If you think about the traditional way in which mental health care services are delivered, we do have medication, which we frankly don't know much about with the medication in the mental health field, and we have outpatient therapy. And that's usually about an hour appointment a week. That is so limited in the data collection. We know humans are terrible reporters, terrible historians, right? If we can add more data, maybe we can up that 50% improvement rate. If we can think about helping people when they don't achieve a diagnosis, but maybe just they have a couple of different symptoms, and doing that real time, I'm just having worry, but I don't qualify for a mental health diagnosis. Or I'm just having problems with focus, maybe I'll do some cognitive training. So thinking about how can we use the data that we have kind of constantly streaming and offering up to our environment, how do we organize it, how do we use it to develop new inferences, insights using large LLM models and things along that line, so that we can come back to helping that individual person with their healthcare. Again, the idea of also thinking about healthcare, not only somebody who is sick, but backing up into preventive healthcare, backing up to doing the blood pressure check, so thinking in the field of mental health care, doing screenings for mental health care, and addressing things before they become a mental health diagnosis. And I don't think I've seen anybody from the payer folks here, but just thinking from a payer perspective, how can we have more emphasis earlier on down the line to help people, to help them kind of live their best lives? both physically and mentally. So can I go back to something you said about, you were saying about healthcare disparity, it's important in the data gathering and the diversity. How do we not recreate the big mess we're in now of having a horrible, horrible problem with digital divide, and particularly the expensive technology? What can we do to not do this again? I'm worried.
Me too. Which is why I think it's important that all the stakeholders are in the room when we're thinking about these types of advances. And I'm going to go back to interoperability, because if we start at the very beginning thinking about interoperability at the broadest level, that actually helps us create things that work for the broadest number of people. I always love going back to the curb cuts. So curb cuts, as you know, with this sidewalk where the sidewalk goes down to make it easy to cross the street. That was done because of the Americans Disability Act. They were not thinking about strollers. They were not thinking about little old ladies carrying heavy bags, and they weren't thinking about young women wearing heels. But those curb cuts help all of us. So being able to think from the very beginning about all of the people and what their unique needs are and what they would need to overcome the digital divide, what types of data, what types of interfaces, it will actually help everybody. We just have to start thinking about it from the beginning. I see we have 2 minutes left.
So why don't we each go ahead and kind of give your takeaway and what you're most excited about, starting at the end. What you're most excited about with Web3 and impacting on health behavior change.
Oh. I want
30 seconds or...
Oh, okay. I would say that the perception change. The Web3 based on the ownership for each individual. Actually taking care of themselves' health is in charge of ourselves actually. But we usually miss and forget about that. So it will help to reshape our understanding and our willingness to control, manage my health proactively. I hope so.
I think the opportunity to redo it, because the fundamental difference of Web3 is individual ownership. It actually gives us an opportunity to use lessons learned to create the environment that we envision for our society in a very thoughtful and prospective way. We're not stuck with what Web 2 gave us and the issues that have arisen. And we're smarter and better now. We can do it differently if we put that forethought into it.
I think I might echo some of your comments earlier. I think we talk a lot about patient empowerment, for example, right? But a lot of it has been like, oh, maybe there's a financial incentive. Maybe we need to pay them, maybe this is. And I look forward to the time when that value will be recognized by the patient to say, oh, I can see this, it's going to help change, this is going to help my health. And that it's going to be the same way that digital health eventually might not exist anymore in its form because it'll be absorbed, it'll just be health. Like Web3, blockchain, that'll be a means to an end. And there will be value that's created that we will take convince people because it'll be that. That's what I look forward to.
Excellent. I'm going to go super optimistic. So I look forward to depathologizing healthcare. So thinking more in wellness and health rather than the disease model that our health system is currently based around. I look forward to empowerment. So people taking responsibility and accountability and excitement and ownership of their health. So much of us can impact on our health, but it's sometimes we're not really sure how. And step one, you got to better understand what you're managing, what kind of data can go in to figure out how you modify that data. So I wanted to thank everybody and exciting opportunities and challenges. We're going to move forward and We're going to learn along the way, make mistakes along the way, but it's an exciting time we're all in. And thank you to Alex and thank you to Tori in this conference. I really